Today's topic is amyloidosis. Amyloidosis is a rare disease in which abnormal proteins known as amyloid builds up in organs and tissues. Amyloid is produced in the bone marrow and can be deposited in any tissue or organ. When amyloid proteins clump together, they form amyloid deposits. As the amount of amyloid deposits increase in a tissue or organ, they interfere with the healthy function of such tissue or organ. Eventually, these cause serious health problems that can lead to life-threatening organ failure. Amyloid protein deposits may be localized, as in affecting only a single tissue or organ, such as the lung, skin, bladder, and bowel, or may be systemic, as in affecting many tissues or organs, and can cause serious changes virtually in any organ of the body, including the heart and kidneys. In the developed world, about 1 out of 1,000 people die from amyloidosis. Types and causes. There are about 30 different types of amyloidosis caused by different proteins folding, but only a few have been linked to major health problems. The type of protein and where it collects determine the type of amyloidosis. The different types include immunoglobulin light chain amyloidosis is the most common type and can affect the skin, nerves, kidneys, liver, and heart. The cause is unknown, but it happens when the bone marrow makes abnormal antibodies that can't be broken down. It is a disorder of the plasma cells, a type of white blood cell responsible for the production of immunoglobulin or antibodies. It is linked to a bone marrow cancer called myeloma cancer. It was previously known as primary amyloidosis. AA amyloidosis was previously called secondary amyloidosis. In this condition, the A protein builds up in tissues. It mostly affects the kidney, but occasionally the digestive tract, liver, or heart. It is associated with some chronic infectious or inflammatory diseases, such as rheumatoid arthritis or inflammatory bowel disease, as in ulcerative colitis or Crohn's disease. Hereditary amyloidosis or familial amyloidosis is a rare form, usually inherited, and often affects the kidneys, heart, nerves, and liver. Many genetic defects present at birth are associated with an increased risk of amyloid disease. The most common ones are composed of the protein transthyretin, or TTR, produced in the liver. Familial amyloidosis is inherited in an autosomal dominant pattern. Dialysis-related amyloidosis is more common in older adults and people who have been on long-term dialysis. The amyloid deposits are composed of beta-2 microglobulin that often builds up around bones, joints, and tendons. Symptoms. In some cases, symptoms may not be present until the condition is advanced. When symptoms are evident, they usually depend on the organs affected. They include severe fatigue and weakness, shortness of breath, swelling of ankles and legs, diarrhea with blood or constipation, an enlarged tongue, an irregular heartbeat, difficulty swallowing, unintentional weight loss, numbness, pain, or tingling in the hands and feet, skin changes such as purple patches around the eyes, thickening or easy bruising, high level of proteins in urine, less appetite, sweating problems, coordination problems. Diagnosis and treatment. To make a diagnosis, the doctor will review your medical history and carry out a physical exam, after which you may have blood and urine test to detect abnormal protein that may indicate amyloidosis, biopsy, imaging tests of the affected organs. This may help to determine the extent of the condition. Treatment. There is no cure for amyloidosis. Treatment option may help limit symptoms and limit further amyloid production. Specific treatment depends on the type, and they include chemotherapy with stem cell transplant for AL amyloidosis, treatment of underlying conditions for AA amyloidosis. This may include an anti-inflammatory medication to treat rheumatoid arthritis, liver transplantation for familial amyloidosis. For dialysis-related amyloidosis, Treatment option may include changing the mode of dialysis or having a kidney transplant. To manage other symptoms, the doctor may recommend pain medication, diuretics and a low-salt diet, medication to control heart rate, blood thinning medication. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.